And welcome back to the Business Spotlight. This is Pat Dewar. Dr. Mary Swift is my guest today. And we're talking about how to, well, not just keep your teeth, but if your parents, like mine, lost their teeth at a younger age, under 50, and that used to be fairly common, what do you do about it? Well, we've been talking about things that you can do. This time, Dr. Mary, the solutions that you mentioned is permanent implants.
For
right?
replacement, yeah.
Replacement.
So if you have to lose a tooth or several teeth or all your teeth, know that there's more than one way to replace them.
Right.
Okay. The Cadillac, I don't know if that's the fanciest car anymore, but the Cadillac is the implants, okay, implant replacement. And even within implant replacement, there's everything from just putting 2 little bitty implants and snapping a full denture on,
right,
to an implant for every single tooth that needs to be replaced. It's very expensive, but it's relative. Okay, if you have to spend the last half of your life
right,
with the replacement of a prosthetic replacement of your own teeth, that's a lot of time to spend in something that isn't perfect. And the best way to get the most realistic replacement of your own teeth would be implants.
Right.
Okay, but they are expensive, okay, and I completely understand that not everyone is going to be able to go there. So there's other ways to replace missing teeth. If you are missing not all of your teeth, but a few, you can do crown and bridge work
right,
to replace the missing teeth. We've had crown and bridge work in dentistry for over 100 years. We've got a great history with crown and bridge work, a little longer than that actually. Whereas, you know, implants not as long. We're getting there, but so it's not that much of a lesser option.
Right.
But it's not as realistic as your own teeth as implants would be. But you've got crown and bridge replacement, and it's again not something that you have to take in and out. It should be permanent in your mouth. So there's an advantage there. And then even if that's more than the patient can afford, you can always do something removable. Okay, so it does come out and go in a jar at night, but you replace the missing teeth, you stabilize the arch so things don't drift around, you don't drill on any other teeth like you would in crown and bridge replacement.
Right.
So if you did something that just comes in and out, you could come back at a later date when you win the lottery or get that big promotion and then do the implants. So the best thing you can do if you can't afford the implants right now is to at least do something so it doesn't get worse.
Right.
So that maybe someday you can go back and do the implants.
You can become a published author. Discover a system that will lead you from idea to having your book on the bookshelves. Bob Baer pulls back the curtain at the More Power to Publish workshop. Watch and learn how to follow the step-by-step plan to turn your idea into a published book. Learn more at morepowertopublish.com.